human genetics and it happened to me to San Diego if I was going to try to figure out where that gene or genes are in that chunk of chromosome 11. As a reflection of the challenges of funding, Chris, sadly, despite really having such a great mind for science, left science and actually now has a very successful brewing company. If you're ever in Papworth, England, stop for a Papworth brew and make sure you acknowledge Chris. So, I haven't gone down that path yet. And it was during that time that many of you know who will be speaking, I think, tomorrow or Wednesday, Teresa Bettina, who is really the only other full-time person doing research, more clinical in her case, on Jacobsen syndrome, and she is in Catania, Italy. And one of the things that Teresa has done is she also has mentored graduate students to literally earn their PhD in Jacobsen syndrome, and that's really quite an challenge is to get those people to stay in the field, which is not so easy. And then at that time, and to this day, I believe, the only other researcher doing any kind of research on anything related to Jacobsen syndrome is Dr. Remy Favier in Paris, and I'm going to talk a lot more about that on Wednesday. The title of my talk is Paris-Trousseau syndrome, What You Need to Know. But a lot of what I'm going to talk to you about is based on the early work dating back to the 90s that Remy has done at that hospital in Paris, which is why it's called Paris-Trousseau. And then as it became apparent that after some of the medical problems, the most challenging long-term issues were cognition and behavior. And that's when I was fortunate to reel in a couple of colleagues in San Diego, PhD psychologists, who worked with us for about the next 10 years to begin to characterize sort of what that cognitive and behavioral profile is of people with Jacobsen syndrome. And then around, I guess, 2012, I think some of the people might remember that conference, it became apparent to me that there were people with Jacobsen syndrome that were actually suffering life-threatening, sometimes even fatal infections. And this actually became very clear when states began to do, as part of their newborn screening, assessing for something called severe combined immunodeficiency. And several patients with Jacobsen syndrome came back positive. So a genetic test and some reports of really bad outcomes of people with Jacobsen syndrome due to infections. And that led to my reaching out to Ken Ferris on the left, who's in New Orleans, and unfortunately is not available this week, but also Virgil Dom, who should be coming in this evening, all the way from Holland. And the two of them have been just saviors, literally, to help us to, first of all, define what the varying degrees of immunodeficiency are in your kids, and to literally come up with life-saving strategies for your children. And you'll hear all about that from Virgil's talk. Challenge number 3. So this is kind of stating the obvious. The conferences, which are so great, and I truly mean for me, one of the great opportunities is not just for you guys to learn, but for me to learn from you. And that continues to this day. And as I have already alluded to, it's also been very personally rewarding for me because you guys are really kind of like an extended family, even the newbies that are here. So it's really a special treat for me. So we had the first one, as Lindsay said, in Del Mar, just outside of San Diego in 1998. We had about 35 families, which was not bad for a start. A lot of them, obviously, from the West Coast and California. And then based on those initial interactions, we actually came up with a questionnaire and began to survey prospectively what kinds of medical problems and other problems your children were having. And that led to our first paper that we published in 2004 of about 110 patients. And just to give you perspective, before that, the next biggest study that had been published was on 17. So we really ramped up our understanding just based on pure numbers. And we also came up with clinical guidelines, which have been sort of evolving over the years, but you should see those on the website. All right, so part of all this, of course, is identifying what are the biggest medical issues. And so these are historically the most severe life-threatening problems that can arise, which is probably old news and infant use of bleeding problems and brain hemorrhages, infection, and of course, congenital heart disease. Now, the good news is, I think This is just an example of a young lady from Denmark who actually died from an infection of her heart. So again, to raise awareness of the risk of infections. So I mentioned this already, that it was at this conference in 2012 that it really came out just by having conversations in groups just like this. And all of a sudden, everyone's raising their hand. Yeah, my kid has had 5 pneumonias, or my kid was in an ICU for bacterial sepsis. So not just little benign infections like ear infections, but really some pretty serious life-threatening. That has led now to, let me go back. That has led to a protocol now that is available that hopefully most, if not all of you have seen, where we recommend anybody with Jacobsen syndrome undergoes a comprehensive evaluation of their immune system. And thanks to Ken and Virgil, there are now literally life-saving protocols, specifically in either prophylactic antibiotics and or intravenous or intramuscular injection of antibodies to prevent infections. And I can tell you, I've talked to a number of families where they say the difference is night and day once their child has been started on these treatments. So, and again, brain hemorrhages kind of relating to the bleeding problem, but there may be some predisposition to an aneurysm, so an enlargement of blood vessels in the brain that are at risk for rupture. So if you combine that with the bleeding issue, bleeding propensity, some of you have experienced that firsthand in this room, it's a very concerning life-threatening complication. So we published this paper, which included making sure that people get at least a baseline imaging study of their brain and the brain vasculature. Okay, COVID posed another big problem because obviously if you're immunodeficient and there's this potentially life-threatening virus running around, that's a bad combination. And so unfortunately, through working and talking to families like you, what we learned is that despite most people having some problem with making antibodies, at least for the number of cases that I saw of people with Jacobsen syndrome, after they got the vaccine, they were shown to actually be able to produce antibodies. So that was huge, because now we can say, get the COVID vaccine, make antibodies, and then you don't have to continue to live in a bubble, because even with your presumably some degree of immunodeficiency, in most cases, you're still able to mount a proper immune response. And that was really like a liberation, I think, for families. We also published this paper because, as I talked about, hypoplastic left heart syndrome, as if that's not serious enough, add on to that complication of a genetic syndrome. And I can tell you, not so much in the United States, but from other countries around the world, I have had families say that when their baby was diagnosed with hypoplastic left heart syndrome, they weren't given any option for surgery. In other words, they were just left to pass away. And that I knew was not right, because with the progress that we had made in the United States and our own individual experience, like with this little boy, with knowledge, knowing, for example, there's risk for bleeding, knowing there's a risk for infection, knowing there might be an increased risk for seizures, that these children at a first approximation can undergo the usual kind of surgical palliation that we do. And so I frequently refer people, let's say physicians reaching out to me, this paper that is reassuring that with some knowledge, you can have a good outcome. Okay, so again, we talked about bleeding, we talked about infection, we heard of that. Chuck Haymeyer is an enormously talented attorney that I've gotten to know starting about 20 years ago, who specifically works to advocate for families with developmental or genetic syndromes, rare disorders, because it has historically been a very overlooked population of patients, because rare diseases are just that. And Chuck, with his expertise, again, was the one who actually enabled us to create these so-called protocols that we have now for bleeding and infection. And these protocols, if you're not aware, are actually a medical legal document, so that if you hand this protocol to your treating physicians, they are medically obligated to abide by that. And if they don't do that, you can go talk to Chuck. I should say that with now our ability to anticipate problems with bleeding and infection, I think today in 2026 is the complex congenital heart defects that are the most common cause of mortality in Jacobsen syndrome. All right, so what about my research? You'll hear a lot more about this on Wednesday. This is just a little bit of an example of one of the technologies. In the old days, people used to just get a karyotype analysis, which is a very imprecise demonstration of the chromosomes, okay? But it doesn't give you any information about specific genes. And this technology came about in the late 2000s called microarray or array comparative genomic hybridization. I don't know how you do that. And this allowed us to now map deletions to the individual gene level. And that was a huge step forward, both clinically to help you to decide what problems your children might be at risk for, but also for my research for gene discovery. And this is an example. This was a little girl from Colorado who was born with hypoplastic left heart syndrome, who had a relatively small deletion, about half the size of Eckert's. And because of that, that allowed us in one fell swoop to narrow down a region containing maybe about 150 genes down to 50 genes. So again, this technology that gives us a readout of the individual genes has been a huge part of our research. She sadly passed away at about age 10 from complications to getting heart transplant. These are two siblings in England with Jacobsen syndrome. They had the identical deletion, but very different heart defects. So that told us a little bit more about the complexity of the genetics, which we were beginning to identify from answers, explain why either two different kids have two different heart defects, or maybe how two kids with the same deletion, one might have hypoplastic left heart syndrome and another completely normal heart. It's definitely not so straightforward. This was another young little baby born with hypoplastic left heart syndrome who had a very unusual type of chromosomal rearrangement abnormality. You can't see it here, but basically these are chromosomes, and they're little red dots that show where the end of chromosome 11 is. And the red dots, I'm not going to try to show it to you on this screen, allowed us to actually pinpoint at the molecular level one of the genes now that we think is the cause of some of the heart defects of these Jacobsen syndrome. So it's amazing how one patient, as I've already explained, can just catapult your understanding, but it has to be the right patient in terms of the research. And we published this paper, which showed now evidence for one of the genes. And you'll hear me talk a lot more about that on Wednesday. And this gene is called ETS1. It's a part of a family of genes that's referred to as transcription factors. And you can think of transcription factors as regulators, or like a switch, an on-off switch that turns on genes and turns off genes. Normally when, let's say, the heart is developing, but then again, these same genes can be turning on or off genes abnormally in situations like cancer. And there's actually a lot of overlap, believe it or not. This gene that we found that's critical for heart development has also been shown to have a role in certain forms of cancer. So it's not just the function, but it's also the timing and location. This is a young man who will be coming here on Wednesday, the Sanfield family, an hour away in Lafayette, who is one of the first patients we were able to study to actually use a type of technology where we can take cells from the patient, let's say in this case with a heart defect, and actually genetically reprogram those cells to become heart cells. And when we compare his to a normal patient, we can study what's different, and that's given us some really important insights into the function of this gene. And this was actually a paper we published just a few years ago showing how one type of heart defect that some of your kids have, called a ventricular septal defect, special type of double outlet right ventricle, is due to the effect on one population of cells critical for the heart to develop. And I'll tell you more about that on Wednesday. But that was pretty cool because that paper not only got published, but a figure got published on the cover. So we're covers. And then in a different population of cells, we showed that you get a different type of heart defect, not hypoplastic left heart syndrome in this case. This is in a mouse, by the way. But a different type of problem where the ventricle doesn't develop normally. And again, I'll talk to you more about that on Wednesday. And then most recently, and this is what we're really excited about, is we've learned more about one population of cells in the developing heart that goes wrong. What we found is that if you think back about hypoplastic left heart syndrome, you can imagine it's due to lack of growth, right? The left ventricle doesn't grow out and it's unable to pump blood. And what we have found in our most recent paper is that this population of cells in which ETS1 is being expressed actually regulates or turns on the expression of two cardiac growth factors. And that is really exciting because we think that it's a deficiency of these growth factors that leads to the underdevelopment of that ventricle. But where it also may be really exciting is if I start feeling chest pain right now and go to the ER and I'm having a heart attack, when I'm having a heart attack, what's actually happening is heart cells are getting killed off. But we think that maybe with these factors, and I'll tell you that more on Wednesday, we might be able to treat someone that's having a heart attack so that instead of that dead heart tissue being replaced by scar tissue, we can now promote new growth, regeneration of the heart muscle. And that would be way beyond anything I could ever have imagined. So we're really, really excited about that. And this was a really nice accompanying editorial. You guys, if you haven't want any of these, I can get access to that for you. And it really shows the perspective, again, of how we started with this rare disease and how there may be much, much broader, more really powerful application. So stay tuned to that. I'm just going to go through this pretty quickly. I know we're running low on time. Behavioral problems, cognitive problems, you're going to hear some talks about that. We've identified some genes that we think are really contributory and lend themselves to the possibility of sort of gene-based therapies. This young lady, Robin Olney, was actually diagnosed back in 2004 with autism. And I was really shocked because to me, it seems like a lot of the Jacobsen syndrome are like hypersocial, kind of in your face. That went against kind of my perception of autism, but she had a very thoughtful evaluation done at a program in Belgium, and it turns out that autism is actually pretty common in Jacobsen syndrome. And we went on to publish a few papers. These are two genes that are involved in cognitive function, and this is our characterization of a gene that we think causes, at least contributes to autism in a subset of people with Jacobsen syndrome. And then lastly, on that subject, a group in Japan was also happening to be studying this gene and found that a commonly used drug called clonazepam may be, in some circumstances, able to help compensate for the loss of this gene that causes autism. Okay, unfortunately, I'll just kind of run through this. Basically, my two PhD psychology colleagues have retired. But just to allude to, like I said, clonazepam may be beneficial in certain situations. And also, where is Sophia and Don? Yes, so they are pioneers in this because thanks to Sophia being in a study a number of years ago, I know I'm violating all of it. It turns out the anxiety drug called buspirone, Buspar, may help with a certain type of cognitive function and perhaps also sleep. So that remains to be seen, but we're excited about the potential. All right, we're getting towards the end of my challenges here. So fundraising has been an ongoing issue that probably keeps me up at night more than anything else it has to do in my work. So first of all, many of you in this room already have done incredible things. And remember, I said before, there's going to be a lot of comments by me if it weren't for I, and we wouldn't be here today. And for so many people in this room and elsewhere, your fundraising efforts have made it possible to keep this research going. So I truly wouldn't be here without that kind of support that many of you have participated in. So what do we need? So what does it really break down? So at UCSD, basically, I'm viewed as a clinician. They're very happy to see me see as many patients as possible and get reimbursement for that. I have gotten lab space, which is great, but what I don't get from UCSD is the money to actually run the lab pay the people that do this incredible work. And they don't give me any protected time. So basically, I'm a volunteer researcher at this point. Sort of a shoestring budget for my lab is about $350,000 a year, which covers salary and mouse housing and reagents and that kind of stuff. So over the years, we've had some really fun fundraising events that some of you have been part of. Craig Thomas and his wife, Rebecca. Craig is the co-creator of that really wonderful television series from years ago that many of you are aware of now, called How I Met Your Mother. And while the show was running during its 9-year run, they had 2 fundraisers on the set, and those 2 each raised about $150,000. And since that time, after the show went off about 10 years ago, each year they continued to reach out to their friends and colleagues to help raise anywhere from about $100,000 and $150,000 a year. So basically what that means is Craig and Rebecca, through their efforts alone, have raised somewhere around $2 million over the last 18 years or so. So that's an amazing thing. They weren't able to make it, but he asked me to make sure I send all you guys their best wishes. So moving right along. So these are just some of the more recent organizations, including you guys, that have been so instrumental to sort of keep my lab alive. This just took place a few weeks ago in New York City. A few of you were there. And what was really cool is I got to be a rock and roll star for like 97. So, and Elliot was the real star wherever they are. He played the drums and he crushed it. It was really a blast. And this is their final song. There's Elliot singing along. All right. I'm just going to kind of skip over this. This might be something we can talk about in the business meeting, but one of the challenges has really been spreading the information. So, you know, we've accumulated a huge amount of information that's now, thanks to Kelsey, wherever you are, and others, have been able to get that up on the website. But so sadly, how many times do I read Facebook messages where people say, my child has bleeding problems. Does anyone else's child ever have bleeding problems? Like, we've done this for 25 years. So, and I don't say that in a critical way, except that we need to find a better way to get that information out there. And that would be, I think, a great ongoing topic of discussion. So say that for another day. One of the things that's been posted on that on our website is basically all of the peer-reviewed medical and scientific publications over the last, whatever, 50 years. Elena Chavez is a medical student who worked with Kelsey to make that happen. This is just an idea of how many publications have been generated since, well, really 1973. So it's really exponential, and that's really exciting because ultimately all of you guys are going to benefit from this work. And it's up to about 190 now if you just put in Jacobsen syndrome and do a search. All right, this is always the toughest, is when we lose people with Jacobsen syndrome. These are 3 babies that all passed away in 2023 from complications from their heart defect. And remarkably, despite such a god-awful experience in their time of most severe pain, each of these babies' families actually donated their heart to my research. So we have made some really, really exciting strides that I'll tell you more about on Wednesday. That really changes their understanding of how at least hypoplastic left heart syndrome occurs in Jacobsen syndrome. And like I mentioned before, another example, I wouldn't be here today. We wouldn't be here today probably if it weren't for Edgar and his incredibly loving, supportive family, who sadly passed away just 6 months or so ago. So while I'm on the subject of I wouldn't be here today without my parents, they actually passed away right after the 2014 conference, about 8 weeks apart. But have to acknowledge where we come from, right? Never forget our roots. And of course, my wife, Susan, and our son, Stefan, that's from a year ago, send all of you their love and wish they could be here, but it's a little bit complicated. So anyway, but you are truly part of our family. And this is actually kind of a bittersweet story. So Susan's mom, Rosa, had been living with us for a couple of years after her father passed away. And so over the years, Rosa attended a lot of these conferences, the ones that were in San Diego. Some of you, I think, actually got to meet her. The conference from 2 years ago in Carlsbad was literally the last any kind of social event that Rosa attended. And that night at the last day of the conference, she suddenly unexpectedly passed away. But you guys had a very special place in her heart. So that was really special just to see how you guys embraced her. That meant really so much to her. All right, just to finish, I know I'm running late. Sorry, Peter. Petey, where are you? There's always more to learn. And one of my favorite actors, I love this quote. He says, "Real listening is a willingness to let the other person change you. When I'm willing to let them change me, something happens between us that's more interesting than just a pair of dueling monologues." And I think that's a great lesson for all of us in the medical and science fields. I've had some fun over the years when my son was younger, coaching some of his various sports teams. And until he got to high school, then that was like over my head. But I don't know how many of you have ever read any of the books by John Wooden. I always made it a point to give the graduating kids from our sports teams one of his books. But I think he was maybe the greatest sports coach ever. And I love his quote, make each day your masterpiece. And this was from a few years ago in Germany. It's just such a sweet picture. I think it shows that special mother-son relationship. Okay, so I'm going to finish at the risk of sounding presumptuous. So I'll make a challenge to all of you. Coincidentally, it ends up being challenge number 11. You know, and I don't mean to cry wolf, but it is an ongoing struggle and challenge for me to get that $350,000 a year. I already had to let go of one of my 2 PhDs a couple of years ago because I already knew that the writing was on the wall. So this is my challenge, is to starting now, between now and January 1st, if each of you can ideally reach out to your family and friends and raise $1,000, that would be amazing. That would allow me to survive, because right now I don't have any funding basically past the beginning of this year, at the end of this year. So 6 months, okay? Stay tuned. And